Hello everyone. So last week we had a referral from another hospital regarding a 32-year-old male. So he had a fever for 4 days. He's actually a gym trainer by occupation. So they have done all the investigation. Every investigation was normal. So they are referred for cardiology opinion. So when I see the patient and when I did the echo, so I found one of the serious infection of the heart, that is infective endocarditis. So today I will explain about what is infective endocarditis, how to treat and how to manage. Welcome to Heart Health Made Simple channel. So infective endocarditis is infection of the inner lining of the heart, that is endocardium, along with the valves. So there should be some predisposing risk factors like IV drug abuse. Patient should have a history of like valvular heart disease, any artificial valves, or with poor dental hygiene. So these are the risk factors for infective endocarditis. So what are the symptoms? So the most common symptom is fever, that is prolonged fever which is not getting relieved by normal antibiotics. And sometimes patient can have heart failure symptoms. They can have a valvular regurgitation or leakage of the valve in the heart, abscess in the heart, etc. So how to diagnose this? So there are two important tests to diagnose infective endocarditis. Number one is a blood culture. So you have to take 3 blood culture at 3 different sites, okay? And another investigation is echo. So echo is where you see the chunk of the bacterial mass on the valve, that is vegetation, and sometimes in some patients we can see acute valvular regurgitation, that is valve leakages. Sometimes we can see abscess also. So coming to the treatment, so the treatment for this is you have to prescribe antibiotics, that is prolonged antibiotics for 3 to 4 weeks according to the bacterial culture and sensitivity. So coming to our patient, so when I took the history, so he actually is a gym trainer, so he was using IV steroids for his muscle growth and muscle build-up. So this is the echo of this patient. There is tachycardia, and you can see there is a vegetation sitting on the aortic valve which is oscillating. So this is acute infective endocarditis vegetation, and you can see there is severe aortic regurgitation also. Yeah, so this patient needs IV antibiotics and surgery. This is the size of the vegetation. So the thing is, infective endocarditis, some people who has a prolonged fever with predisposing factors, think of infective endocarditis. And number 2, you have to diagnose early, because delayed diagnosis can lead to heart failure, sometimes can cause stroke, cerebral embolic events, kidney failure, and death if untreated. Thank you.